computer. Okay. Hello. Thanks, Dr. Roger Worthington, for re-recording this session. Our original session was recorded with all the speakers on May 4th during STI, Science, Technology, and Innovation Forum on May 4th, 2022. Unfortunately, that recording is lost. So now I have invited our keynote speaker, Dr. Roger Worthington, to re-record his keynote speech. And it's indeed a privilege to have him today. Let me introduce our seventh multi-stakeholder forum on STI. It was a virtual side event, and title was Strengthening National and International Policies in Education and Health. Welcome, everybody. We are in the midst of a digital proliferation around the globe, which is allowing us to be more connected and with greater access to data than ever before. As a result, e-health, e-learning, and mobile health are providing healthcare services and achieving better health outcomes. Access to reliable and broadband internet is becoming essential to health and education sectors in every country, rich and poor alike. Imagine students in developing and developed countries simultaneously reviewing the same medical education and learning from each other. That is e-learning at its best in an internet classrooms. With this goal, Women's Health and Education Center, in collaboration with Department of Public Information and the United Nations, had launched an e-health platform, womenshealthsection.com, in 6 official languages of the United Nations. Its work began on 24th October 2002. 2 decades of serving and advancing global health with our partners and associates has strengthened and reaffirmed our faith that e-health and e-government is the way forward. We are serving in 227 countries and territories. Our special focus is on Sustainable Developmental Goals number 3, 4, 5, 10, 16, and 17. Initiatives of Women's Health and Education Center have a unique role to play in strengthening the health and educational systems worldwide. Technology and innovation in learning are creating exciting new opportunities for accelerating progress towards education for all and health for all in every member states, in every country of the United Nations. Cultural diversity is now the norm in each and every country. Women's Health and Education Center respects the rights of patients, colleagues, and the communities. We plan development together. The objective of today's side event is to share the experiences of various technological solutions in improving the affordability and accessibility of quality healthcare services and STEM. STEM is an acronym which stands for science, technology, engineering, mathematics, and medical programs. The need for good mental health programs in our schools and universities to help our children and teens to acquire the basic skills are needed to create health and improve learning potential. And with and this should be a part of their curriculum. Each new generation of children and teenagers face many health challenges, but those being dealt with by today's children and youth seem to be particularly daunting. Children at an early age are confronted by situations that require decision making, self esteem, problem solving, and coping strategies. People with such skills are more likely to adopt a healthy lifestyle and become a good citizens. Our friends and colleagues and experts today in this side event will highlight how to best apply technology in the learning process. It is a poor and marginalized in our society and in our world. We have the most to gain from the advances in e-health and on-learning. Sadly, at this point, they are often the groups who benefit the least. Maternal health and or women's health is a multifaceted problem with social, psychological, and cultural roots. There is no simple or single solution for this segment of population. Women's health care must be addressed at multiple levels and in multiple sectors of society to develop effective projects and programs. For several decades, we had the knowledge and means to remove much of the risk and uncertainty associated with childbirth. With growing motivation and political will, the need for better information network has become more urgent. Girls, women, and minorities have right to quality health care and education everywhere. We should aim to ensure universal health care and affordable quality education for all. Let us not leave anybody behind. Our suggestions and recommendations for areas for future development are health promoting schools, both physical and mental health, a long-term plan that is binding on all parties at all times, sustainable finance, support for pilot projects, programs, and their conversion to regular programs as soon as they prove successful. Involvement of health authorities at national, state, and district levels. Government commitment is necessary. A global fund for continuing medical education, and eighth, improving the accessibility for girls, women, and minorities to STEM programs. WHEC supports capacity building for e-health and e-government applications worldwide. And we look forward to developing the use of norms and standards with the World Health Organization. We aim to reach least developed countries identified by United Nations Development Program to disseminate reproductive health research and evidence-based information. WHEC provides free access to online e-learning, e-health to least developed countries. Our linked access project, LINK is again an acronym. It means learning, innovating, network for knowledge, encourages national health and educational system to contribute towards continued education at all levels to improve maternal and child health, culturally appropriate contraception advice, information, and availability, prevention of teen pregnancies, end of child marriages, and violence against women and children are of utmost importance. By interacting with different cultures, we will learn to respect diversity, building the capacity to care in a global responsibility. And this is our responsibility, and this is our generation's opportunity. We believe on this path, effort never goes to waste, and there is no failure. Thank you. Now it's indeed my privilege to welcome our keynote speaker, Dr. Roger Worthington, who is based in London. He's an independent researcher, and his resume expands like a thesis. So I will not go into the details, but Roger, welcome. And his topic is refugee healthcare and the need for it. Go ahead, Roger.
Thank you, Rita, for that introduction and for your kind words. It's very interesting to hear you set the scene and provide the context for this. So really, my topic is about educating for health, but very much almost entirely focused on refugees and trying to meet their healthcare needs. So I will now share my screen and run some slides. Just get that to run. Okay, so that is the title of my talk. And I've just provided a little bit of information about myself. A lot of my work now is actually in connection with the UN SDG Publishers Compact. I joined as a fellow at the end of last year. The work of this group is really taking off, I'm pleased to say. I will move on now to the topic of the day. This is not something to be taken lightly. Refugee health is a growing concern, and the conflict in Ukraine has made things so much worse for so many people. And meeting the healthcare needs of large numbers of refugees is really, really important. The numbers are quite frightening. When I started researching this subject a few years ago, UNHCR estimates were around 70 million refugees and displaced persons around the world. The most recent figure is now 100 million, which is just a staggering number. These images are from refugees fleeing the war in Ukraine. And you see there are all women and children, just a few people of my age, older people who are not able to fight and who are allowed to leave the country. They come with pre-existing health conditions, but then they have the new health conditions associated with the stress, the extreme stress, both mental and physical, associated with their flight from their homes. Now, the international conventions are well established, but it's one thing to claim that health is a human right, and that includes and extends to all refugees. But the obligation to satisfy that right is a necessary but not sufficient means to ensure that the needs are met. And I was making the claim on its own is a beginning, but it doesn't necessarily make enough difference on the ground. So where do we go from here? Well, I see myself primarily as an educator. So my approach to this is to think, well, what can we do to improve the workforce training so that healthcare professionals are better able to meet the needs of this large and vulnerable group? So in addition to political will and social commitment, we need a well-trained workforce. The first two things in that bullet point are crucial, but they fall outside the scope of my talk. So nurses and all healthcare professionals need the right skills to be able to treat this population. And there may be different and special skills over and above the ones that were part of their normal, regular training. Now, global health education is increasingly part of healthcare professionals' education programs, particularly in terms of continuing education and professional development. And actually, that is quite a good opportunity to address these issues for a number of reasons, one of which is that by the time a healthcare professional is fully trained, they've had a little bit of experience in the clinic or out in the field, as well as having more life experience. So I have nothing against teaching global health or refugee health to students during their primary training, but it more typically falls within the continuing education framework. And my principal argument is that that refugee health should be a core component of these programs, global health programs. And from my research, that is often not the case. And there are large numbers of global health programs that make no mention of it whatsoever. And I think this is wrong. I specifically mentioned nurses simply because they provide a lot of the day-to-day healthcare needs of the healthcare professionals, but I do not limit the content of this to nurses. So this is not something, as with really most of the sustainable development goals, all the sustainable development goals, this is not something to weigh into and debate in the future. It needs addressing now, particularly against the context of these ever-growing numbers. I have benchmarked the work that I'm doing against sustainable development goals. And like the goals that Rita mentioned, the content of this particular talk directly address goals 3, 5, and 10. I'll talk about that more in a moment. So I strongly believe that nursing schools and other training schools should include refugee health in their programs. So given that displaced persons may find themselves living in cities or in camps far away from their homes, somehow they have to try and satisfy their healthcare needs. And these needs could be significant. We're not just talking about minor ailments. These could be life-threatening conditions. And while education alone is not going to change the political reality, it could certainly help the healthcare professionals. It is my opinion that education specifically related to refugee health can help the healthcare professionals to be more effective at meeting the needs of this population. So unless the refugees, the displaced persons, go back to their homeland, which many do, but large numbers are not able to, perhaps they may never be able to go back home, hopefully they will eventually become part of the community. And the point that I'm making here is that refugee health is not something that you think of as simply applying to refugee camps in places like Lebanon, Turkey, Bangladesh, Somalia, anywhere around the world. Displaced persons can find themselves living in communities, particularly big multicultural cities, anywhere in the world. So it is not just a dedicated volunteer healthcare professional who is going to be asked to treat refugees. It could be any healthcare professional. It could be a primary care physician. It could be a community nurse. So this is why it needs to be, this subject needs to be addressed far more widely than is the case at the moment. Now, these patients are already somewhat disadvantaged, of course, substantially, because they've had to leave their home. But in addition, specifically in terms of accessing healthcare, language is often a significant barrier, as well as cultural issues. Language, for instance, in a country like Turkey, which has a very high proportion of refugees amongst its population, a lot of those refugees have fled the war in Syria, and Syrians and Turks do not share languages at all, and very few refugees can speak Turkish, and Syrian is not a language that most Turks will have learned. So these are barriers that have to be overcome, as well as cultural issues associated with the needs of these women and children. I'll come back to that again later. So a mix of skills is needed. and these may not presently be being taught. Now, in order to try and address this problem, I have drafted a set of learning outcomes, and I would like to run these through and spend a few minutes on this, because my hope is that by making this public, it can help educators and provide, these are indicative learning outcomes. I speak with no authority. I simply put these forward as being something that could be helpful. And if healthcare educators can use them, so much the better. If they need to modify them, that is also fine. The work has been published in Journal of Nursing and Healthcare. The DOI is there. But these, I've developed a framework, and there are 12 points to this. And I will spend a moment on each one. So a healthcare professional needs to be aware of the public health risks associated with migration. These are crucial. And if the international agencies, for instance, don't address the public health risks, then the consequences can be really dire. You only have to think about the earthquake in Haiti and the problems with cholera associated with failed interventions and the failure to address the public health risks. The healthcare professional needs to be aware of the type and scope of problems encountered by refugees. And perhaps the most telling part of this point is the last bit. And I believe that the healthcare professional can be very supportive, not just in providing healthcare, but in being an advocate. Because if somebody is in need of professional healthcare and being a refugee and displaced, disconnected from their networks, normal family and geographical networks, the healthcare professional can be the most effective person to advocate on their behalf. Now, not all doctors or nurses can act as advocates for all their patients, but there may be times when they can step up and do something that would really make a difference to their patients. The next point is about being able to demonstrate relevant skills for treating problems specifically associated with migration. And the point here is working with whatever resources are available. The circumstances in which many refugees live may be very suboptimal, and that applies also to the healthcare workers. Here, perhaps there is a distinction between the doctor working in a comfortable clinic in a big city as opposed to somebody working in a field hospital and giving healthcare in a tent, perhaps with no running water or essential services. So the healthcare professional, it depends where they're working, but they have to learn to adapt and do the best they can with the resources that are available. Moving on, leadership is a crucial issue. And again, the healthcare professional is in a unique position because by demonstrating leadership skills, they can help to affect change that can really improve the lives of the healthcare professionals. Clearly in relation to meeting their healthcare needs, but possibly going beyond those needs. The healthcare professional needs to be resilient because it's not only the refugees that might suffer from social stigma. Healthcare professionals themselves could be stigmatized. And people could say, well, why are you bothering? Why are you spending your time volunteering or working with these groups? And that is not an appropriate question to ask, in my view. But there may be pressures brought to bear on the healthcare professional for working in this field. And so that's why they need to show resilience. Moving on, this point is sort of roughly in the middle of this list of 12, and for good reason. Mental and physical health problems are so intimately connected that I think that the two are effectively one. Because if somebody is suffering from a physical condition, it is bound to affect their mental state. And particularly for refugees and displaced people who've been through extreme trauma. Think of children perhaps who witness things that they should never have to see as a child in situations of violent conflict. The mental, emotional, and psychological scars are going to run very, very deep. So the healthcare professional needs to be aware of these, and they don't all have to be trained psychiatrists, but they should be aware of the link between the mental, physical, and psychological needs of refugees. There is always somebody who knows less than you do. So even a relatively early career healthcare professional has something to teach. It may be a trainee, it may be a medical student, but be willing and prepared to teach the skills that you have, especially if you've got experience of working with this group. Supposing you volunteered and did field work, as a clinical placement, for instance, that could give you valuable experiences, which you're then in a position to share with others. But the same also applies if you're working in the community. So as a healthcare professional, you should be able to explain the relevance of refugee health in urban primary care, not just in the field. And I probably made that point already, because this is for refugees who have settled and are living within the community, and then have to overcome the various barriers of accessing the healthcare system. The next one is about identifying and recognizing the vulnerability of this group, because it is a question of not just doing the sort of Band-Aid type approach, but really trying to identify the needs and taking the appropriate actions, even if it's just pointing somebody in the right direction where they can get further help. Medical emergencies can happen just as much in refugee communities as anywhere else. So that anybody who's studying global health should also have done some sort of basic training in first aid and dealing with medical emergencies. And again, even if it's just knowing how to direct somebody or to take immediate action to try and save somebody's life before they go to receive further healthcare. And this is where I come back to the question of language and cultural competency. I'm pleased to say that cultural competency is increasingly being taught in medical schools. But the language issue is very fundamental. I think I've already addressed that, and that can apply to any refugee who's fled their homeland. Almost the chances of them having to deal with a foreign language and possibly of no notice, suddenly finding themselves in a country where they do not know a single word, leads to extreme vulnerability. The cultural competency here is really where a refugee has moved from one part of the world, one set of social circumstances, if you like, to something completely different. I'm thinking, say, of somebody who's fled from Central or South America up into the USA, or somebody from Sub-Saharan Africa entering Europe. Their cultural reference points, as well as their language skills, are going to be completely different. And so the healthcare professional needs to be mindful of this. Being mindful is one thing, but my last point is also important, because the healthcare professional can acknowledge these social customs, but it doesn't necessarily mean that they have to accept them as being lawful or ethical. Because supposing the healthcare professional is working in a big multicultural city in Europe or North America, well, the codes of practice, the professional expectations are clearly set out. And if you as a healthcare professional do not follow those, your own license to practice, your registration could be at risk. So if somebody comes from a very different culture and asks you to do a procedure which you're really unhappy with, that does not necessarily mean that you have to comply with that. I'm not going to try and generalize here, because each of these issues has to be dealt with in its own way. But as a broad point, I think it's important to be sensitive to this assume, and to be aware of the ethical implications in terms of how to go about meeting the healthcare needs of this group. So in terms of what next and where we can go from here, if you're watching this and you run a global health program, please see if any of these objectives are useful. And if you would like, please incorporate them in your programs and adapt them as you see fit. But if you're a trainee, maybe speak to your program director and see if you can get some of this added to the curriculum. If global health, particularly if global health is already part of your training and education, it's easier to add it in. But I've had enough experience of clinical education to know that it takes a long time to develop a new curriculum. Even just adding a learn objective can take time and involve committees and all kinds of bureaucracies. But sometimes the trainee can be the catalyst for change by putting pressure on their seniors and their supervisors and saying, well, I want to know these things, can you help? Finally, I make the references to SDG 3, 5, and 10 relating to health, gender equality, and inequalities more broadly. And if these development goals can be met more effectively, it should directly benefit the refugees. But I will make the point that I have actually been through and benchmarked each one of these 12 points against the SDGs, but the language is slightly different. In other words, the keywords that I use are not built in to the Sustainable Development Goals, but I'm drawing on the concepts and making the connections, and that is very often the best way to apply the Sustainable Development Goals in a clinical practice situation. So thank you very much for your time, and I hope this was of use. Rita, back to you.
Okay, thank you, Roger. It was very informative. And let me ask you a question. You focused on health of these refugees, which is definitely a very essential aspect of the life and everything. What about the education of these refugee children, primary education and a higher education, so they can settle in whatever country they are in and build their life better?
Absolutely, crucially important. And you reminded me of something else which I didn't include in my talk. And that is that one way of getting around these language and cultural barriers is to use the professional skills that refugees and displaced people bring with them, because amongst this group will be doctors and nurses and all kinds of other specialists. And they can be the most effective advocates because they understand the problems. They understand the language issue, they understand the cultural issues, and if they've got language skills, then they can act as translators and interpreters. So yes, you're right. You're absolutely right, Rita, that ordinary basic education is crucial. I didn't attempt to cover it because my focus was on healthcare, but you're absolutely right, and you've reminded me of the need to draw on the resources that are available within the community, and refugees themselves who become integrated and go into clinical practice can become very, very powerful advocates and achieve amazing things. And I constantly read about examples of people who have done just that, and I've met a number of people who have done that. So it's about transferable skills, if you like.
Good, thank you. And do you have any models or any country who have implemented these health projects or programs and the education programs for the kids? Do you know any countries who have implemented them?
Rita, can I just ask you to clarify? Are you talking about this framework that I developed, or are you talking more generally about refugee education?
Both, as a matter of fact, both.
Well, that's a big question. I'll do my best. In terms of providing primary education, the big NGOs are very active in that field. So through UNHCR, UNICEF, there would be large, many examples of primary education, for instance, being made available. For later education, higher education, the issues are slightly different, and I haven't researched that, but I'm always sort of mindful of the education needs for refugees, and I don't have any examples to hand. But in terms of my own framework, what I'm doing, because this work is relatively new, I only published this a couple of years ago, but with the help of people like yourself, I have been giving talks to a number of groups. And for example, I co-ran a workshop with a group of pediatricians in Istanbul recently. And there are about 45 pediatricians in this group. It was all done on Microsoft Teams, all done remotely. And myself and the pediatrician addressed these issues. She was providing direct clinical experience based on her work in the field. And she was from LA, so her specialization was in relation to migrants coming up from Central and South America and crossing the US southern border. But I have, with some of my students, done some quite specific work in relation to Turkey. And I'm working with a group of clinicians in Turkey at the moment with a view to helping to develop their programs. And in fact, some of the questions that came up after that session dealt directly with my special area of expertise, which is ethics. And a few years ago, I was asked by a non-profit to develop an online ethics course, medical ethics course, which would be available open access. And it was in 12 parts, and it was self-assessed, and it ran for a number of years and was quite successful. Had a large uptake. Although interestingly, although it was developed for use in developing countries, low middle income countries, a lot of the people that used that program were from North America and Europe and stuff, because they did not have much or any ethical training as part of their medical education. So in terms, coming back to your question about Turkey, when I started to get into the ethical and legal situation that is specific to Turkey, with their very large numbers of Syrian refugees, we're going to do some further work there with a view to making this resource available in Turkey, because the platform that it was on, unfortunately, has folded because it was reliant upon donations. And when the pandemic hit in 2020, the money dried up and the program is no longer available online. But I'm hoping that will be remedied soon.
Good. We look forward to be the part of it. And as you know, Roger, at United Nations, 2022 high-level political forum has granted a side event to Women's Health and Education Center, which is on 7th of July. And we are lucky to have you again. Would you like to expand on this education program? You may not have time, but any of your colleagues or the main person or the focal point who's working on you with the Turkey will be happy to invite them.
Oh, excellent.
This we will definitely. So send me the list of the speakers who are working, who will be interested in speak about this project you are doing in Turkey. And because we have a very good relationship with the United Nations and a UN Secretariat, I think I sent you their email, and the delegation from Turkey would love to hear that.
Well, maybe we could make some connections there, so that we could possibly try and get a little bit of seed funding to make this happen, because it does need some resources to get it
Exactly.
So perhaps that's something we could explore at a later date. But certainly, Rita, thank you for inviting me to be part of this next event. And I will indeed make connections with my Turkish colleagues.
Good,
as well as my friend in Los Angeles. So
good. Thank you. So anything else you would like to share, or it was a
well,
very
it's
good
a
question.
subject I will continue to work with, and I'm giving regular talks on it, and I've still got a number of students working on individual projects, some of whom have published papers. So there is a lot of scope for further work.
Exactly. And I
Specific.
wanted to tell you what the resources we have available through this NGO, Women's Health Education Center. I am glad we made a connection with the Turkey. We would like to invite them. Second is we have a youth leadership program from Women's Health and Education Center. We invite youth leaders. So I'm glad you said your students are working. Uh, any student who is very enthusiastic and would like to share his thoughts and opinion. For the youth leader, there is only one restriction, that youth leader has to be less than 30 years old. I don't make the rules. This is UN ECOSOC's rule to qualify for, and they get the grants. And when they like the students' work or youth leaders' work, UN ECOSOC gives them the grant. But this age limit is there. I wish if I was the person, I would have done the age limit 50, but nobody listens here. So.
Well, thank you for telling me about that, and we must correspond about that, because my students are often quite young, and
Yes.
and although some of them are graduate students, some of them are pre-college and really young, and it's this. I'm giving them their first sort of taste of research experience, and hopefully
Good.
developing a long-term interest. So certainly for my graduate students, I can think of a couple who would be quite interested in looking at these opportunities. So
Because refugee is becoming such a big problem, is such a main problem, and world should not hate refugee. We all were refugee at once upon a time. And I really want to focus on the education part of the refugee and the health part of the refugee problems, which is about, I think, in millions number, and during our HLPF in July. And so help me create the curriculum for our side event, which is coming in July.
Sure, I will be glad to do that, Rita.
Good.
So
Good,
thank you.
good. Thank you. Anything else? I would love to. I mean, these are the resources I have open for you. And this way your message will get across. And hopefully it lands on somebody's table who can do something and implement, I mean, implementation part.
Well, this is very exciting, Rita, and I appreciate the opportunity, and I know you have very good connections. So we must definitely explore these openings. And yes, I mean, if we can make or definitely make a connection with our colleagues in Turkey, because they are looking at this right now, and we've got good high levels of clinical support from. It's a big teaching hospital that this was run at, and if we can develop some networks there, then we could get something up and running and available online, for instance, and it can be universally accessible. So, I mean, that is something that we could achieve within a relatively short time frame. And certainly, if I can get some of my students, applying for some of these programs, then there are definitely openings there. And I do mentor young students, and I've got them from all over the world: China, South Korea, North America, all over.
Yeah, because I've been a physician all my life, and especially obstetrician and gynecologist. When babies are born, they are not born with hate. They are not born with the violence. They are not born with the bad things. But we learn all these things. And if we interact with the different colored people, different type of lifestyle and different, we will have patience, we will develop tolerance. That's how you do it. There is no medicine to develop tolerance, and peace cannot be bought with money. If the world wants a peace, it cannot be bought with money. It has to be human psychology, human attitude. And let's start working on the children and make it up.
Yeah, absolutely. I entirely support what you're saying. And we will continue to collaborate, Rita.
Thank you. Anything else, Roger?
No, I think we've had a good discussion, and
Yes.
thank you for the opportunity to continue, to have this conversation, because you caused me to reflect on things, and we've made some connections and come up with some ideas for further work. So let's explore that another time.
Exactly. And whenever you want any Zoom meeting, let me know. I'm open for you. And it's a good start.
Indeed.
Thank you.
Thank you very much.
So let's go. Thank you. Thank you to our audience. Any question for the Dr. Roger Worthington, please contact him directly or contact me. I'll be happy to send the message to him. Thank you. Thank you, Roger.
Thank you.